Diabetic retinopathy is a major complication of uncontrolled diabetes. So these are changes inside the eye. When you have diabetes, there are problems with blood barriers, and there is leakage of blood from the blood vessels inside the eye. And what happens is, if these are untreated, they then bleed a lot more, and then they produce scar tissue. When that scar tissue then becomes a lot more, it actually produces what is called retinal detachment that leads to blindness. So I started this when I was living in Bradford a long time ago. I realized when I was working in the hospital that a lot of ethnic groups were coming in with sight-threatening retinopathy, which was at a much higher level than the Caucasians living in that area. That got me thinking, what is this about? Is it genetic or is it something else? So that's where my research started. We found loads of barriers. Patients didn't know about their diet. They didn't know that there was a difference between having a retinopathy screening done and going to an optometrist, for example. If you do attend retinopathy screening and if it's picked up early, the risk of blindness decreases by around 60 to 90%. So that was the problem. And we also realized that it wasn't genetic, really, it's lifestyle. And we found that whilst diabetic training is an integral part of diabetic care, a lot of these patients weren't actually attending because there were no culturally or linguistically appropriate training programs. So we started off co-developing with patients but healthcare providers about how we can actually educate and improve awareness. And now we run these programs all over the country. We have now got 15 different languages of these programs. We take them to grassroots levels, we take them to mosques, temples, everywhere, not just now in the UK, but in 15 different countries in the world. And to date, they've reduced the risk of blindness in over 150,000 people. We've set up diagnostic hubs in the community. There's one here in the Vision and Eye Research Institute. We started with just 2 clinics a week. We're now running 20 clinics a week. And I've now also set up these in Mid and South Essex with Mid and South Essex Foundation Trust. Up to now, we've actually seen and reduced the waiting list of over 40,000 patients. So our world-class research has led to a really good impact where we've tried to reduce the risk of blindness.